Hi, I have a patient here. We're going to start on cervical decompression. First thing that we do, we want to make sure that her head fits nicely into this cradle. We have a few different sizes, so we're just going to fit her just like this. And is that pretty comfortable there in your neck and everything? Okay, so it seems pretty good. What we do is we just push that onto the cradle attachment that's already here. And if you're looking at this machine, it has both lumbar on this side and cervical. We're talking about cervical today. You can go ahead and step up there. There's handles there for you to grab hold of. Nice thing about this machine is it lays down for you. So really this is it. That's the most that she has to do. So I'm gently gonna go ahead and lay you down flat. And then your head's not gonna fit in there now because it's taller than you are. So what we're gonna do is have you scoot into it a little bit once it lays down all the way flat. So it doesn't go down quickly, and then also there's nothing above her. So if there's anyone that's worried about being felt like you're trapped in here, it's totally open. Okay, you're gonna go ahead and bend your knees. Hold on 1 second. Go ahead and get back down. Bend your knees one at a time. So one at a time, bend your knees. There you go. Now, just a little bit, I want you to give yourself a scoot until you get your head into that cradle. Do you feel yourself in there snug? Is this pushing up against your shoulder blades at all? Good. So we program this machine to target the certain angle that we want in her neck. So it could be C5, C4, C3. In her case, it's going to be C5, and that's already adjusted. We do that here on the machine. So it's already adjusted. I'm just going to set the headpiece in for her so it's at the correct angle and lock it in place. After I do that, I'm going to put something underneath her legs, a bolster here, so that her back feels more comfortable. And then you can go ahead and relax one at a time. Go ahead and relax your legs on there, and I'll get it more in place. There you go. Fairly comfortable? Okay. Then I have a strap that goes across her forehead. You might want to take your glasses off for this point because the strap might interfere with your glasses there. So this isn't too tight, it's just a little snug, just making sure that her head is secure. Is that all right? Good. The last thing I do is attach the strap to the headpiece. It's not running yet. I'll just set up the machine for her to run. Making sure it's all set. So once it starts running, what this is going to do is gently pull on her cervical spine. Again, it's targeted the area, in her case C5. And when it's pulling, it's gently drawing in water, oxygen, and nutrients into that disc. This could be a number of different reasons that we're doing this. Could be a herniated disc, a bulging disc. There's whiplash from car accident. There's so many different reasons why we would do this. So many things that we can help with doing decompression, also in the lumbar spine. But again, gently pulling in water, oxygen, and nutrients. So this is a non-invasive treatment. Once treatment is done, she can drive home just as she drove herself in, along with other treatments that we do throughout the day. So for her, just depends on how long our patient is here. Might be asking yourself, well, where does this liquid come from that we're using? This is your epidural fluid, surrounds your spine. So this fluid comes from your own body. That's what makes this non-invasive treatment. So it's perfect for the person who has tried everything, does not want to do surgery, because it offers that alternative solution. So this is not a Band-Aid for your pain. This is a solution to solve the problem so you don't have that symptom of pain. Anything else?